Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to the honorable judges, lecturers and those who are joining today. I am Sabrina, and along with me Fadzliana, we are going to present our research with title The Cytotoxic Effects of Novel Non-Porous Simvastatin Microparticles Towards Human Nasopharyngeal Carcinoma, an in vitro study which supervised by TS Dr. Aliana Hidayah Mohamed and Sir Muhammad Aizad Abdul Rahim. Human nasopharyngeal carcinoma, also known as NPC, is one of the most common head and neck cancers with the highest incidence and mortality rates in Asian countries, including Malaysia. Based on World Health Organization (WHO), in 2020, nasopharynx cancer is listed at top 5 for new cases and top 6 for the death in Malaysia. Despite the fact that majority of patients have been cured, there are still challenges in prevention of the disease relapse, treatments of patients with refractory or metastatic NPC, and also management of long-term toxicities. So, in our study, we use Simvastatin to treat this cancer. Simvastatin is cholesterol-lowering drug which belongs to the statin family, and it is widely used as a safe and well-tolerated therapeutic agent. Statins have been shown to have anti-proliferative and apoptotic activity against a variety of cancer cell lines, includes breast, prostate, and colon cancers. Simvastatin has gained a lot of attention because it has the potential to be anti-carcinogenic when compared to the other statins. However, simvastatin alone may cause cancer cells to develop chemoresistance. To prevent this from happening, we decided to encapsulate the simvastatin into microparticles with size ranging ±1 to 100 micrometer. The reason why we choose to encapsulate it because the microparticles will help to protect the drug, which is the simvastatin, from environment, protect the body from the side effects, and also it will improve the effect of the drug. In addition, Chitosan also is added into this study as coating material to the microparticles. Chitosan helps to modify the drug release behavior of microparticles with moderate and sustained release. Okay, so next is our objective. We would like to investigate the effects of encapsulated simvastatin-loaded microparticles as anti-proliferative agents on human nasopharyngeal carcinoma by using RPMI-2650 cell line. Moving on to our methodology, the simvastatin microparticles are first prepared using a double immersion solvent evaporation technique, and then these samples were observed under scanning electron microscope imaging (SEM) and high performance liquid chromatography (HPLC). SEM helps to observe the morphology of the microparticles. So, these are the expectation results where there are non-porous microparticles with various sizes. Next is HPLC. We use this to evaluate the encapsulation efficiency and also to evaluate the drug-loading simvastatin non-porous microparticles. Then, RPMI-2650 cell line were cultured and treated with these 4 types of samples with various concentrations, which are simvastatin alone T1, PLGA simvastatin microparticles T2, PLGA simvastatin Chitosan microparticles T3, and lastly, the positive control cisplatin T4. These samples then were assessed with MTT assay with different time manner, which are 24 hours, 48 hours, and 72 hours. These data then were converted into percentage of salvability and were analyzed with repeated measure of variance to identify the significant differences within groups.
Assalamualaikum and good morning. I am Fadzliana. I will continue with the result part. The first part is microparticle preparation. This image shown are the result of non-porous microparticle that is varied in size distribution observed under scanning electron microscope. As we can see in the first image is the different sizes of simvastatin microparticles in 1 mg per ml. The second image is simvastatin microparticles in 2 mg per ml, and the third image is simvastatin microparticle in 3 mg per ml. While the last image shown is simvastatin microparticles that is coated with Chitosan. Moving on to the cell viability result using MTT assay. The time observation of this study were made at 24 hours, 48 hours, and 72 hours. Study showed that cell viability decreased in RPMI-2650 cells line that is treated with T1, T2, T3 in concentration time-dependent manner. As we can see in the graph shown, the cells that is treated with simvastatin alone, which is T1, showed a great cell reduction after 72 hours of treatment with 1, 2, and 3 mg per ml from 100% to 0.17%, 0.43%, and 0.44% respectively. In T1, the reduction in 1, 2, and 3 mg per ml is significant as compared in 24, 48, and 72 hours. Next, for the cell treated with PLGA simvastatin microparticle, which is T2, we can see in the graph that T2 showed a decrease in cell viability in 24, 48, and 72 hours. Cell growth reduction were seen greatly after 72 hours of treatment with 1, 2, and 3 mg per ml of T2, in which the cell viability decreased from 100% to 29.84%, 24.19%, and 30.27% respectively. In T2, the reduction in 1, 2, and 3 mg per ml is significant as compared in 24, 48, and 72 hours. Moving on to the cells treated with PLGA simvastatin Chitosan microparticles, which is T3, we can see in the graph that the group of cells treated showed decreased cell growth reduction in slow manners as compared to T1 and T2 just now. It showed cell growth reduction after 72 hours of treatment with 1, 2, and 3 mg per ml of T3 from 100% to 76.34%, 68.65%, and 65.92% respectively. In T3, the reduction in 1, 2, and 3 mg per ml is significant as compared in 24, 48, and 72 hours. This graph shows sample with various concentration at different time points. As we can see, simvastatin showed the highest acceleration of killing effects, followed by simvastatin microparticles and simvastatin microparticle that is coated with chitosan. The study found that there is significant difference between 3 different samples in 24, 48, and 72 hours using repeated measured ANOVA. Next, for statistical analysis, repeated measure analysis of variance was applied. For analysis of anti-cancer properties at different time points, there was a significant difference of mean cell viability within each sample group on time. It also showed that there was a significant difference in comparison between cells treated with T1, T2, T3, and control group against 3 different time points. For analysis of anti-cancer properties between treated group regardless of time effect, the test between subject effects showed that there were significant difference of mean cell viability among 4 samples with p-value less than 0.001 regardless of time. For analysis of anti-cancer properties between treated group in 24, 48, and 72 hours, it shows that there was significant difference of mean cell viability among 3 different samples, T1, T2, and T3, based on time and concentration, with p-value less than 0.001. Moving on to the discussion part, there are extensive literature on the pleiotropic effect of simvastatin against nasopharyngeal carcinoma. However, by encapsulating simvastatin in the microparticles could be another option in anti-cancer delivery to the targeting site. In this study, it is conclusively showed both T2 and T3 showed cytotoxic effect against nasopharyngeal carcinoma cell growth in a slow-release manner as compared to the treatment with simvastatin alone. Moreover, coating the simvastatin PLGA microparticles with chitosan significantly sustained the simvastatin release. This is desirable action of drugs to reduce the side effects of simvastatin. Hence, T2 and T3 showed a good option in delivering anti-cancer drug with a great association in reduction of tumor cell growth and cell death. We would like to highlight the novelty of this work. Study of simvastatin on nasopharyngeal carcinoma had received Gold Award in IIDEX 2019 and Bronze Award in IIDEX 2020. This is pattern from UiTM for micro-X bone tissue grafting material as the preparation for microparticle is similar. In conclusion, this study demonstrates that simvastatin microparticles is associated with reduction of tumor cell growth and death. In addition, fabrication of microparticle with chitosan will not only reduce the number of cell viability, but also reduce the release of simvastatin, which is useful in drug delivery strategy for anti-cancer treatment. Study conclusively shown that there is potentially therapeutic intervention of anti-cancer using simvastatin microparticles with chitosan as coating material. This is our references. That is all from us. Thank you.